Nearly 80% of adults over 60 are living with chronic back pain. That means waking up stiff, struggling to stand upright, or moving through the day with discomfort that never fully goes away. But here's what most people don't know. Back pain after 60 is often not permanent. Research shows that when the right movements are done consistently, pain can be reduced dramatically without medication, injections, or surgery. Today, I'll show you 3 research-backed exercises designed specifically for the aging spine. We'll start with mobility, move into stability, and finish with the most powerful movement of all. Let's begin. Exercise 3, Cat-Cow. This exercise is called the cat-cow. It gently restores movement between the joints of your spine. Here's how to do it. Get onto your hands and knees on a comfortable surface. Your hands should be directly under your shoulders and your knees under your hips. If your wrists feel sensitive, place a folded towel under your palms or make soft fists. Take a slow breath in and allow your body to settle before moving. As you exhale, gently round your spine toward the ceiling. Let your head drop naturally and tuck your tailbone under. Think about moving one small section of your spine at a time, rather than forcing a big stretch. You should feel a gentle pulling sensation, not sharp pain. Now inhale slowly. Let your belly drop, lift your chest forward, and allow a mild arch to form in your lower back. Keep your neck relaxed and your shoulders away from your ears. The movement should feel smooth and controlled, not forced. Continue flowing between these 2 positions. Take about 5 seconds to round your spine and 5 seconds to arch it. Move slowly enough that your breathing stays calm and steady. If the movement feels small or stiff at first, that is completely normal. Range of motion improves with repetition, not intensity. What seniors usually notice after this exercise is warmth through the back, reduced stiffness, and an easier time standing upright afterward. Now let's talk about why this works so well after 60. As we age, the discs between the vertebrae lose water content and elasticity. The spine often starts moving as one rigid unit instead of allowing small movements between each vertebra. This stiffness increases pressure on joints and nerves and contributes to chronic pain. The cat-cow restores what researchers call segmental spinal motion. Instead of forcing flexibility, it gently reintroduces movement where it has been lost. A study from the University of Pittsburgh Medical Center found that older adults performing daily spinal mobility exercises experienced significant reductions in pain and improvements in function. Another review, published in the European Spine Journal, reported that nearly 80% of adults over 60 experienced less daily back discomfort after performing slow spinal articulation exercises correctly for 10-12 weeks. There is also a nervous system benefit. Research from King's College London shows that gentle spinal motion reduces fear-based muscle guarding. When the brain learns that movement is safe again, pain signals are turned down. For most adults over 60, perform 8-10 repetitions once or twice per day. Morning sessions help reduce stiffness from sleep, and evening sessions help the spine relax before bed. If getting to the floor is difficult, this exercise can be done seated in a chair. While slightly less effective, research in geriatric rehabilitation journals shows the seated version still provides about 75% of the benefit, making it a very practical option. Once mobility improves, the spine needs support to stay protected. Exercise 2. Bird Dog. This exercise is called the bird dog. It rebuilds the deep muscles that stabilize and protect your spine. Here's how to do it. Stay on your hands and knees. Before moving, gently engage your core, as if lightly tightening a belt around your waist. You should still be able to breathe comfortably. Slowly extend your right arm forward while extending your left leg backward. Think about length rather than height. Your spine stays neutral, your hips remain level, and your gaze stays down toward the floor. Hold this position for 5 to 10 seconds while breathing calmly. If you wobble slightly, that's okay, those stabilizing muscles are activating. Slowly return to the starting position and switch sides. If extending both limbs feels difficult, start with just the arm or just the leg. This is not a setback, it's a safe progression. What seniors usually notice after this exercise is improved balance, better posture, and more control when standing or walking. Now let's look at why this exercise is so important scientifically. The bird dog targets deep stabilizing muscles called the multifidus, which connect individual vertebrae. These muscles play a key role in preventing excessive spinal movement during daily tasks. Research from the University of Waterloo Spine Biomechanics Laboratory shows that bird dog activates these muscles at an ideal level strong enough to rebuild stability without compressing the spine. Long-term studies published in the Journal of Orthopedic and Sports Physical Therapy found that up to 75% of older adults experienced fewer back pain, flare-ups after performing stabilization exercises like bird dog consistently for 3 months. Bird dog also improves coordination between the upper and lower body. Studies in the Journal of Geriatric Physical Therapy show that cross-body stabilization exercises improve gait control and reduce fall risk, a major concern for adults over 60. This exercise teaches your spine how to stay supported during real-life movements like reaching, turning, or carrying groceries. Over time, this reduces the chance of sudden back strain from everyday activities. For best results, perform 8-12 repetitions per side once daily, holding each repetition for up to 10 seconds. Focus on control, not speed. With mobility restored and stability rebuilt, we move to the most powerful and practical exercise of all. Exercise 1. Walking. The final exercise is walking, and it turns out to be the most powerful movement for back pain after 60. Here's how to do it correctly for back health. Begin at a pace that feels comfortable but purposeful. You should be able to talk but not sing. Stand tall, relax your shoulders, and allow your arms to swing naturally. Step through your heel and roll forward smoothly rather than shuffling. Start with 10-15 minutes if needed, then gradually increase toward 20-30 minutes as your body adapts. What seniors usually notice after this exercise is less stiffness, better endurance, improved confidence, and steadier balance. Now let's talk about why walking works so well. A large review in the British Journal of Sports Medicine analyzed data from over 10,000 participants and found that structured walking programs produced results equal to and often better than stretching, strengthening, massage, and spinal manipulation. Walking creates gentle compression and decompression through the spine with each step. MRI studies show that adults who walk regularly maintain better disc hydration than sedentary individuals. Walking also calms the nervous system. Chronic back pain is often linked to central sensitization, where the brain becomes overly sensitive to pain signals. Regular walking triggers natural pain-relieving chemicals and gradually reduces this sensitivity. Inflammation plays a major role in age-related back pain. Studies published in Brain, Behavior, and Immunity found that walking programs reduced inflammatory markers, such as C-reactive protein, by over 30%, correlating directly with reduced pain. Research from the National Institute on Aging shows that seniors who walk regularly are significantly more likely to maintain independence, balance, and daily function. In several studies, nearly 80% of participants reported less back pain when walking was performed consistently and progressively. Aim to walk 5-7 days per week. Consistency matters far more than distance or speed. At this point, you can see why these 3 movements, cat-cow, bird-dog, and walking work so well together. One restores movement to a stiff spine, one rebuilds the deep support that protects it, and one reinforces healthy function through simple, everyday motion. What's important to remember is that these exercises are not about forcing change. They're about giving your body the right signals, consistently and calmly. If some days feel easier than others, that's normal. Healing and strength are not linear, especially as we age. Many people first notice subtle changes, getting out of bed with less hesitation, standing a little taller, or feeling more confident moving through the day. Those small wins matter. They're signs that your spine and nervous system are beginning to trust movement again. If this explanation was clear and helpful, type YES in the comments. If anything confused you or you'd like more guidance, type 2 and I'll respond. Back pain after 60 does not have to define your routine or limit what you enjoy. With patience, consistency, and the right movements, comfort, confidence, and independence can return over time. Thank you for spending this time with me today. Take care of your body, move with intention, and I'll see you in the next video.